Hello and welcome to Coronavirus Q&A. Tonight and every Monday night, we're going to try to answer as many of your questions as possible about the COVID-19 pandemic. On the show this evening, we have Saffron Cordery from the organisation that represents NHS hospitals. Dr Sarah Jarvis will once again be answering your health questions. For all things financial, practical and a whole lot more, Choi will be here. And we'll be live with Alex Noren in Sweden, the country that isn't in lockdown. We want to hear from you. You can send us an email at coronavirus@itv.com. You can post your comment on Twitter and Instagram using the hashtag coronavirusQA, or you can join the chat on our Facebook page. All that to come, but first, here's what you need to know this week. It was 2 weeks tonight the Prime Minister Boris Johnson asked us all to stay at home. He is spending a second night in hospital 10 days after he tested positive for the virus.
I can tell you the PM had a comfortable night in hospital and he's in good spirits.
The death toll in the UK today passed 5,000. But there's some hope as new infections and deaths are finally falling in Italy and in Spain. The pandemic has changed all of our lives and is putting huge pressure on our NHS. So how is it coping? My first guest tonight speaks on behalf of all hospitals in England and all ambulance services. Saffron Cordery from NHS Providers joins me now to answer some of your questions. Welcome. First question is from a hospital worker who asks, why are some trusts following national guidelines that say we only wear masks when someone has symptoms confirmed or is being shielded? Surely you are putting all nurses and care assistants' lives at risk.
So I think that the issue around this protective equipment has been really hotly debated, and we know that the guidelines that have come out recently, we hope restore people's confidence that wearing different types of protective equipment in different environments is the safe thing to do. So it's really important if you're working up very closely with a patient who has coronavirus that you have absolutely the adequate protection, particularly if you're doing something where you're likely to come into contact with the droplets of the virus. If you are simply working in the same space as them, then we know that you need less protective equipment. It's quite a complex set of guidelines, but they have been endorsed by the World Health Organization. So really important to remember that.
Oh, well, that brings me on to the next question, and you may have already answered it, actually, but another question from someone who doesn't want to give their name this evening. They want to know, I would like to know if the likes of porters and domestic assistants will also be given the correct PPE as they are working on wards with coronavirus patients.
I think, as I said in my previous answer, it's really important to remember that it's about proximity and the kind of interaction you're having with patients. We've got to remember that it's a droplet-borne virus rather than an airborne virus. So that means that it's about coughing and sneezing in close proximity. So whilst we obviously want porters and other healthcare workers to be protected, we don't think, and the guidance says that they don't need that higher level of protective equipment. And the reason that's important, that we don't give everybody the highest level protective equipment, is that obviously we have to make sure that we maintain our supplies over a longer period of time.
Sure. We've had lots of questions about testing, Saffron. Here's one from Heidi in Sheffield. She is a staff nurse. She says, I've been on the list for a week. I'm getting worse and displaying a lot of the symptoms. I also have underlying health conditions, but trying to stay out of hospital. Why are our GPs and employers not testing us?
So I think that this issue of testing has been really hotly contested, and what we need to see is sufficient testing capacity so that we can test patients, we can test staff, healthcare staff, so that we can get them back to work. The aspiration of government, and we're not part of government, but the government's aspiration is that there will be 100,000 people tested every day by the end of April. At the moment, we're probably at around 12 or 13,000 when we're doing really well. So there's a long way to go the NHS is trying to prioritise so that those staff who are most needed on the front line get tested as quickly as possible. Because at the moment, we've got a really high vacancy rate because we've got people self-isolating, we've got people who are unwell, or we've got people who are vulnerable and having to stay at home anyway. So there's lots in there about testing that we really need to make sure we're testing the right people. But at the moment, we do know that we aren't testing enough people quickly enough.
Lots of people have been getting in touch about cancer care. Dominic from Bolton writes, why are so many cancer patients having treatment and surgery stopped? People are being told that staff are being moved from cancer patients to help with COVID-19 outbreak. Is this true?
We know that lots of the focus of the NHS and particularly frontline workers has been on managing this outbreak, this pandemic. We know that what's called elective care, so those kind of routine operations, have been cancelled now so that we can free up not only the staff but also the intensive care capacity, things like ventilators, etc., to look after people. Where someone's condition is life-threatening, then they will still be receiving treatment. But at the moment, this is about where we can put resource to save as many lives as possible. And it's worth remembering that nobody takes these decisions lightly, and it's about balancing up the needs of everybody across the country and also critically stopping the spread of coronavirus. So this is often about delaying rather than cancelling treatment. And I know that it's, we represent hospital trusts, mental health trusts, community trusts, ambulance trusts, and they're all grappling with this issue about the routine care they can continue to provide, as well as the emergency care they need to provide for coronavirus. I mean, over the last month or so, hospitals have freed up around 33,000 beds in order to cope with this surge in demand. That's a huge amount. That's like 50 times the size of my local district hospital. So they've done a huge amount to boost capacity, but unfortunately that does sometimes mean that treatment or operations need to be delayed.
Yeah. Absolutely, incredibly difficult times for everybody in the health service. Saffron Cordery, thank you very much for joining me this evening. We really do appreciate it. As you can imagine, so many of your questions are about your health. Who better to answer a few more of them than Dr Sarah Jarvis? Good evening. There is still some confusion about the stay-at-home rules. Let's start with a question on that from Pam Soper-Dyer.
Hello. My 18-year-old son wants to move in with his girlfriend and her family. Is it too late to move in, or can he move in now? And how long would it be before he could come home again?
Sarah, it is too late, isn't it?
Well, in an ideal world, yes, I would suggest that it is, because what you're doing when you move from one household to another is that you are ensuring that everybody in the household you move to increases their risk if you were at higher risk, or if you came from a lower risk household, you increase your risk. Now, if anybody in that household is at high risk of complications, either somebody who's eligible for an NHS flu jab, or even more, one of the 1.5 million people who's being shielded, I would strongly recommend that you do not go, or that your son does not go. If he did decide to go, you would have to accept that that risk would be increased. And I would certainly not recommend that he came back for the duration of the guidance to stay at home.
All right, Sarah, thank you for that. Nigel has a question about what happens once you've had the virus. Let's hear it.
My daughter, son-in-law, and their two young children of 5 and 3 have just spent 14 days in isolation. They're feeling a lot better now, but my question is, have they got immunity to the virus, and when can they resume normal life?
What's your answer for Nigel?
Well, Nigel, it partly depends on whether they've actually had the virus. Interestingly, when NHS staff have been tested, and we've already heard that not enough of them are being tested, but when they were tested, 85% of people from the NHS who were in isolation, either because they had symptoms or because someone in their family did, turned out to be negative. So your family cannot assume that they've had the virus. If they have had it, however, there is a good chance, but not a guarantee, that they'll be immune. We just don't know enough about the virus to be absolutely certain. However, we think that once people have had it, they will probably be immune. We're not going to know until we've got those antibody tests. And unfortunately, although the government has ordered 17.5 million of them, at the moment, they are not proving very reliable.
Hugh also got in touch. He has a question about after you've had it as well. Let's have a listen.
After and when I've completely recovered from coronavirus, do I have to deep clean my house to make it completely safe for everyone?
Does he?
So if you've had the coronavirus or are likely to have had it, you need to stay in self-isolation for at least 7 days. And if you're feeling better then, even if you've still got a bit of a cough, you can then leave isolation. After that time, you are probably much less infectious. The question he's asking, I think, is, are the things in my house going to continue to be covered with coronavirus? Well, we think that coronavirus can survive for up to 3 days on hard surfaces such as metal or plastic, and probably up to 1 day on cardboard. So as long as nobody comes into the house within a few days of that, then no, you're no more infectious than anybody else.
Dr Sarah Jarvis, for now, thank you very much. We're going to take a short break now, but when we come back, we'll find out why Sweden is still letting people socialise, and
I can touch my head on my legs.
Joel Dommett tells us what he's accomplished during his time in lockdown. Welcome back to Coronavirus Q&A. Before we continue with your questions this evening, we do have an update to bring you on the condition of the Prime Minister. In the last few minutes, Number 10 has confirmed that Boris Johnson has been moved to the intensive care unit at St Thomas's Hospital in London. Juliet Bremner joins me now from the ITV newsroom. What more can you tell us about this very sad development?
Yes, we've just had a statement from Number 10 Downing Street telling us that over the course of the afternoon, the Prime Minister's condition has worsened. And on the advice of his medical team, he has been moved, as you just said, to the intensive care unit at St Thomas's Hospital. We understand he was moved there at about 7 o'clock this evening. We are not being given any further details at the moment, so we can't say whether he's been intubated or whether he's been put on a ventilator. What we do know is that he clearly was in the hospital, needed more than just the tests we were being told he'd gone in for yesterday evening. When the team at this afternoon's press conference were asked about it, they wouldn't give any further detail. It's obvious now that his condition has deteriorated significantly. And we know that if he's unable to run the country, then Dominic Raab, the Foreign Secretary, and the person who also has the title of First Secretary of State, will effectively take up his position while he's unable to carry out that role. But at the moment, we have no more information about exactly what the need was when they moved him from the area where we assume he was under observation into that more serious part of the hospital that looks after those coronavirus victims who need more intensive care. I'm sure we'll learn more later this evening.
Yeah, Juliet, thank you very much for that update. And we'll, of course, bring you all the very latest on the Prime Minister's condition on the ITV News at 10 later on this evening. Now, while the world has gone into lockdown, there's one country that's doing things rather differently. In Sweden, bars and restaurants are still open. Why? And what impact could it have on the country's death toll? Joining me from the capital, Stockholm, is Alex Norén from the Sweden's national broadcaster. Alex, how do Swedes feel about what is happening there?
I'd say that they keep calm, they wash their hands and they carry on moderately. We don't have this general lockdown that we're seeing in many other countries. For instance, in our neighboring countries, Norway, Denmark, Finland, who have taken much more restrictive measures to impose social distancing. This weekend, I was out shopping at IKEA. Of course, it wasn't completely busy, but half busy. The restaurants were shut. And you had these marks on the floor saying that you couldn't queue too close to each other, and they said on the loudspeakers, please keep a distance of 1 meter at least. But still, business is running along in many places. Of course, restaurants and bars and such have been hardly hit. A lot of them are going bust, but that's because people are afraid going out. It's not because there are any restrictions against them being open.
Alex, how long do you think it will stay like that? Do you think you'll see much more restrictions and a lockdown in the future?
Well, the other day, the Prime Minister said that we should count not for staying like this for weeks, but for months. And the government just recently asked permission to impose more restrictive measures quickly without getting approval from the Parliament. So they're apparently getting prepared to step up, but it doesn't look like it now. It looks like they're going to keep it at this moderate lockdown level, which is actually no lockdown at all, except from only the older kids in school stay at home. But otherwise, most schools are open, for instance, whilst in Norway and Denmark, they were shut.
Alex Norén, stay well, and thank you very much for speaking to me this evening. Thank you. I'm joined once again by the ITV News consumer editor, Choi. Let's start with a question from Janet. You can imagine impacts a lot of people right now. She wants to know, if a person has terminal cancer, can their immediate family visit?
Wow, what a question. It shows that the heartbreak so many are going through. If you are receiving end-of-life care, you are allowed one visitor at a time. That has to be a close member of your family or a carer. Otherwise, people, as you know, are increasingly using video conferencing and phones just to create that important bit of contact.
We've had lots and lots of people asking the same question about the list of the 1.5 million most vulnerable. Amy sums it up. Amy thinks she should be in that group, but she hasn't received a text or a letter from the NHS. What should she do?
Well, the people that were on that list of the most severely vulnerable to coronavirus should have had their text or their letter by March the 29th. If you think you should be on that list and you haven't had that communication, please contact your GP.
OK, let's stick with the 1.5 million. I think Dawn, who's contacted us from Hebden Bridge, is in that group. She says, if I received a letter from the NHS telling me I need to self-isolate for 12 weeks, which is what you have to do if you're on the list, will I get sick pay or be furloughed?
Actually, a bit of both. First 2 weeks, if you can't work from home, will be statutory sick pay. Then, with the agreement of your boss, you can be furloughed this new term, meaning you'll be laid off, but on 80% of your salary.
People still want to know about items, shopping coming into their house. Kate asks, do I need to wipe, wash, disinfect all groceries delivered to my house or bought in?
The important thing here is this is not a food-borne infection. It's respiratory. It's in the air. No need to wash your groceries more than normally for fruit and vegetables. It is possible for the virus to live on things like packaging for days. So that's why it's so important to wash your hands after touching the packets.
Wash your hands. Look, the government's travel advice changed over the weekend, but the refund situation remains confusing. Here's one example. As EasyJet have now cancelled all flights, should I be offered a refund rather than a change of flight?
You're entitled to a refund. They keep offering people vouchers. You don't have to accept a voucher or a rebooking. You're entitled to that refund.
We're running out of time. Let's end with a few quick ones. My car hasn't moved in over a week. Can I take it for a drive? Somebody worried about their battery going flat.
True. There are some people that haven't moved for over a week. No, you really can't go for a spin just to boost your battery. That is not an essential journey. If you were stopped by the police, I think they take a pretty dim view of it.
Jeanette has a question. Should children still be delivering newspapers?
I think yes, because they're actually preventing people going to the shops to pick up their newspapers, and it's good that we stay out of the shops wherever possible. And they can social distance whilst they're doing it. They don't even have to touch the letterboxes. They can just put the newspapers there on the front mat, and it's really good exercise. I might try and get myself around, actually.
Lucy wants to know, me and my boyfriend live separately with family, so aren't visiting each other, which is what the government is advising. Can we rent an Airbnb to spend some time together?
Oh, well, it sounds so romantic, doesn't it? But before you light the scented candles, I'm afraid the answer is no, you can't do that. You can still have the scented candles, but not together.
Chris Choi says no. Chris is staying with me, as is Dr Sarah Jarvis, to answer lots more of your questions. Online, you'll find the conversation continuing straight after this programme on our Facebook page or in the ITV News website. We end, though, with another star's take on their life in lockdown. As the country starts its third week staying at home, the comedian Joel Dommett now on who he's calling, family quizzes and his new hobby.
Hello there, I'm Joel Dommett. This is my Lockdown with the Stars. Which is a show that I hope to host once this is all over. Best thing about lockdown is spending quality time with my wife. Worst thing about lockdown is not being able to spend time with my family properly. My new hobby is sliding on a wooden floor with my socks on. I'm getting real good at it. I'm taking corners like sort of Tokyo Drift. Kind of do sort of a dumbbell crossfit-y kind of workout. Got to keep active, people. We had a quiz with my family last night. They all try and cheat. Music that makes me happy. It's like we're putting on like cafe music in the mornings. It's like really like a cool cafe vibe. My most mundane achievement, I can touch my head on my legs when I've been doing yoga. I couldn't do that before. I'll be honest, I haven't taken these trousers off for about 3 weeks. Exercise lots, and then get a dictionary and look up the word stave. It's definitely my wife. Final answer, wife. I'm showering. I'm showering a lot. I'm going the opposite way of other people. I'm showering like 3 times a day. Stay safe. Bye, 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 bye.
Thanks, Joel. Please do keep your questions coming. We'll answer more of them shortly on our website. And we will, of course, have the latest on the Prime Minister's condition on the ITV News at 10. I'll be back at 8 next Monday. Bye-bye. Welcome back to Coronavirus Q&A. With me is the ITV News consumer editor, Choi, and Dr Sarah Jarvis. Sarah Jarvis, if I could just start by asking you to give us some reaction really to this news that we've just heard in the last few minutes, that the Prime Minister Boris Johnson has now been moved into intensive care at St Thomas's Hospital. We know he tested positive for COVID-19 10 days ago, and he was taken to hospital on Sunday night. But this news that his condition has now developed.
So we know that about 1 in 5 people who develop coronavirus are going to go on to get a much more severe version of the infection. And the likelihood of you ending up in intensive care very much depends on, firstly, your age, and secondly, whether you have underlying conditions. So Boris Johnson is kind of in the middle of the age bracket. He's certainly not among the over 80s group, where there is a very, very high risk of serious infection. About 1 in 4 people over 80 will need to be admitted to hospital. Their condition becomes that serious, and nearly 3/4 of them are so ill once they're in hospital, they end up in intensive care. At his age, the risk is much, much lower. But what we do know is that that's almost certainly because, despite sort of standard measures, presumably he's been having oxygen in the hospital through a mask through his nose, and that hasn't been enough to allow enough oxygen to get into his system. So he will be being admitted to intensive care, almost certainly to have possibly something called CPAP, which is continuous positive airways pressure, where oxygen is sort of forced at higher pressure than the outside world into the lungs to try and improve the amount of oxygen going into his system to oxygenate all his vital organs. We haven't as yet heard whether he would need to be ventilated. I suspect we would have been told that that had been the case, but if that was the case, then he would need to be sedated so that the machine could breathe for him.
Sarah, what's your advice for anyone who finds themselves in the same situation as Boris Johnson, where they've had the symptoms of COVID for more than a week?
So unfortunately, what we do know is that while the majority of people will get better, most people who get worse tend to get worse a few days in, somewhere between 5 and 10 days into the condition, depending on which studies you're looking at. And that can really progress very quickly. What we think is happening is that it gets to the stage where the virus gets deep inside the lungs and sets up inflammation, a combination of pneumonia and something called pneumonitis, which is inflammation of the lung tissue. What then happens is that the body's defenses rush in and they are attacking the virus, but they're also attacking healthy lung tissue. So you can find that really very rapidly you develop shortness of breath at rest, and you get to the stage where just talking a few words or a sentence or two can make you short of breath. If that happens, you must call 999.
You must call 999. A really clear message from you there, Sarah. Thank you. I wanted to move on to a lot of people have been contacting us to ask about masks and the changing advice on masks, really. Let's hear this question from Emma Longdon from West Yorkshire.
Are the public meant to wear protective wear such as masks and gloves when out doing exercise?
What would you say, Sarah?
So I would say that the advice really hasn't changed as far as the UK is concerned, and indeed as far as Europe is concerned. The European Centre for Disease Control, which is very much experts in disease control, says that cloth masks, which is what we're talking about for the public, because you shouldn't be using surgical masks or the so-called the more intensive masks, the respirator masks, because frankly, there aren't enough of them to go around for the health service. The European Centre for Disease Control says that they are much less effective than surgical masks, definitely less effective than the so-called FP3 masks. And they may actually make things worse rather than better, because when they get moist, they don't stop the virus from coming in, and you can end up with virus on the inside of your mouth and nose, or on the inside of your mask, where it's easier to get into it. So we do not recommend routinely that people wear masks when they're out. This virus is mostly spread by droplets. Stay at least 6 feet, 2 meters away from anybody else you're meeting, and that is by far your best protection. As for gloves, you can get virus on the outside of those gloves. So unless you're taking them on, not touching your eyes, your nose, and your mouth, and taking them off without touching them, then they're not going to provide much protection either.
All right. Peter and lots of other viewers have got in touch about this conspiracy theory about 5G. He wants to know, can you kill the rumours about 5G mobile towers being installed everywhere and causing this pandemic?
I would be delighted to kill the rumours. Anybody with an ounce of common sense listening is, I hope, going to understand what I'm saying. There are two possible theories, conspiracy theories out there. The first is that it's actually spread through the masks. No, it's not. It's spread when people are infected, cough or sneeze, and those droplets either land on somebody's eyes, nose or mouth, or they land on a hard surface and somebody picks them up. So that one, gone. This has been the case for viruses for years. Every flu vaccine we know spreads that way. Then there's the theory that the radiation is causing the virus to spread because it's suppressing your immune system. Well, 5G, like 3G, 2G, and 4G, is a radio wave. That is a non-ionizing radiation. It does not damage the DNA. And Public Health England is very clear that looking at the international guidance, there is no harm to your health from levels up to 300 gigahertz. The number of gigahertz in 5G is not more than a couple of tens of gigahertz, so way below the level at which it could cause any harm. It is a nonsense.
Dr Sarah Jarvis, thank you very much. Let's go back to Chris now. Lots of different questions for you on all sorts of subjects. Let's start with Suzanne Johnson. She says, my daughter and her fiancé were due to be married on May the 16th this year. One provider has refused a refund. Where do we stand?
Oh dear. A lot of this, wedding bells not ringing because of the restrictions. Those restrictions in place now actually technically only go through until April the 13th. And therefore, a lot of service providers, I don't know what this is, it's a hotel or a chauffeur company, possibly a lucky chimney sweep, who knows? Whatever that service is, it may not have yet been cancelled because the restrictions only go through until just after Easter. Best advice really for Suzanne, don't throw away the wedding hat just yet. There is hope. Not to cancel now because you might lose your money, might lose your deposit. Wait until we've had a review of those restrictions, which will come around April the 13th. And it's highly likely those restrictions will be extended into May. And then the service providers will start to cancel those services. And then you'll be entitled to refunds.
So very similar to the advice about travelling then.
Very similar.
OK, Dave wants to know, I work 300 miles away from my home. Can I drive home on my time off? He doesn't say what job he does, but he explains he's currently working 1 week on, 1 week off.
Yeah, it's such a tough one, this, isn't it? Of course, we know that for people that can't work from home, they can go to work, and there's no real stipulation about how they get to work. What's unusual about this, but not unique, is the 300-mile trip. Very unusual shift pattern. I think that if we're adhering to the spirit of these guidelines, then he should try to minimize travel. That means, first of all, is there any way of working from home? Assuming not, is there any way of having accommodation close to the workplace so you're not making that big trip? If it's no to both of those, then certainly as far as I see it, that journey would be allowed.
OK. And Charlie has got in contact. He or she, I'm sorry, I'm not quite sure. Is there any arrangement for families identified with COVID-19 who don't fall into the vulnerable category when it comes to supermarket deliveries? Some people still trying and failing to get these slots, really.
Oh, yeah, the delivery slots, they're just a nightmare for so many people. Yeah. There just simply isn't the capacity there. Let's pay tribute for a second to the supermarket workers who are desperately trying to boost capacity, but it's nowhere near meeting demand. And for people in this category, if you have been in contact with a member of the household that has symptoms, then you have to self-isolate for 14 days. You shouldn't be going shopping. I'm afraid if you can't get delivery slots from the supermarkets, which is highly likely, you're going to have to be asking friends, family, neighbours. If that's not possible, there is a rapidly developing network of volunteers all across the country. You'll find details online. Some are taking adverts in local newspapers or putting flyers through letterboxes. Look out for them. OK, a couple of ones about the financial aspects of all this. Steve says, I work in sales. My basic salary is very low, but I earn commission. My employers say I'm only entitled to 80% of my basic and nothing else, as per government guidelines. But I've read that if my pay varies, then I'm entitled to the same pay based on the previous tax year. Is that right? That's right. And a lot of people have been confused about this because originally bonuses, commissions were not mentioned by the Treasury. Actually, just over the weekend, a clarification was given, which says, yes, commissions, bonuses can be taken into account. And what will happen in this furlough system is that you can look back over the last year and take the average of your earnings, including that all-important commission.
Lisa from Barnsley wants to know, could you tell me what happens if you are furloughed for 3 months? Do I need to cancel my working tax credits?
Interesting one, this as well, because when you're on furlough, the tax system remains exactly the same. You still pay tax in the same way, and you get tax credits in the same way. And this is quite a topical point as well, because today working tax credit went up by £20 a week.
My last question, I've flip-flopped, but I want to go back to shopping. I've heard a lot of people talk about this. Miss Harpett says, my daughters are single mums and must go shopping with the kids aged 4, 7 and 8, but supermarkets say on the door, no kids are allowed. How do single mums shop with children?
Well, precisely. I've seen those signs, and if there aren't signs, there might be staff from the supermarkets in the car parks or at the doors discouraging large groups. I did actually speak to one supermarket manager who said it was becoming unmanageable because a lot of people getting bored at home were bringing the whole family out to do the shopping like it was a big trip. And what supermarkets are saying is, please, if possible, limit it to one shopper per household. Now, what, for example, Sainsbury's is now saying in writing is children are still welcome if they can't be left at home. I've seen similar wording from Asda and Morrison's, and supermarkets, I think, are showing every sign of being reasonable if you have that conversation with them on the door if you have problems.
Such a learning curve for all of us, isn't it, Chris? Thank you very much. Thank you very much for watching Coronavirus Q&A online. Thank you. Good evening.